Hello everyone, I Ria Pahuja from Economic Times welcome you all to this webinar Digital Healthcare in the Post-Pandemic India. With the onset of 2021, global citizens have entered a very interesting yet chaotic phase with the COVID-19 situation. While the vaccination drives have started in major economies and pandemic is slowly showing the signs of recession in certain geographies, there are also signs of resurgence in a number of other countries. While it's still unclear when this pandemic will end completely, discussions have started around what will be the future look like. Adoption of technology and digital in the domain of healthcare has been massive. Digital healthcare has brought about a greater level of accuracy, efficiency, accessibility, and scale to the existing healthcare ecosystem. As life slowly gets back to the pre COVID levels, we will see the same pace of digital adoption in the healthcare sphere, or will we see a slowdown and old practices will find their way back into our healthcare systems? To address the same questions, this virtual discussion organized by etcio.com in association with Tata Communications today is going to bring together a group of experienced healthcare practitioners, technocrats, digital healthcare solution providers to deep dive into the subject and find answers to such questions. Please join me in welcoming the esteemed panel of speakers here today. We have with us Dr. Shivali Lal, Chairman Gladwin Group, Dr. Virendra Garg, Healthcare Innovations ICMR, Chandigarh, India, Mr. Gaurav Dhingra, Managing Director, RI Infotech Private Limited, Dr. Surya Prakash, Chairman Healthcare Mediethics, and the very last, Mr. Ramdev Krishnan, DGM Healthcare at Tata Communications Limited. A very warm welcome, dear speakers.
Thank you for welcoming us. Yes, it's really a great opportunity for us. Shall I take over right now?
Sure, Mr. Krishnan. Just one thing, I just want to remind my all audience that they can drop in their queries and the questions in the chat box provided. We will be addressing all the questions in the end in our Q&A round. Over to you, sir.
Thank you, Ria. It's a very warm welcome to the panelists, speakers, because on behalf of TataCom, they accepted, spend enough time, and they are pioneer in healthcare industry. Minimum, each one has more than 2.5 years or 20.5 years of experience in healthcare. With that, we would like to salute all these doctors, healthcare providers, nurse, IT entrepreneurs to sail through this, what you call that, as a pandemic that we have never thought of in a life, which can shut down an entire business, entire, vertical of all industries. It's just not any particular industries. It has actually blocked all industries. We had various challenges, and India are ready to face. How do we face? How do we, overcome this COVID economic drop? All the questions were there. In healthcare, right? Particularly in healthcare, the technology needs to be developed. What has to be done in technology? What are the various factors that could help bridge the gap between a doctors and a patient, healthcare providers, and government to govern in future? If there is going to be, we pray that we do not have, but if there is any pandemic which is going to attack us, what is our learning? We have few key, experienced speakers are available here right now with us today. Let's hand over to Mr. Dr. Garg. Dr. Garg sir, please tell us what is your experience and what is your, thought process. What a technology can play a vital role in this, future pandemic situation, sir.
Thank you, Ramdevji. Actually, for last many decades, the healthcare was becoming more and more tech-savvy, and sometimes it was also considered that technology is going to replace doctor partially, but it was a great empowerment of the clinicians with the technologies right from the diagnostics to the critical care. So there was a wide spectrum of the domains in the healthcare in which the technology was enabling clinicians to treat more and more diseases, and it was also reflected in the increased productivity and increased expected age, longevity of the population. But this unprecedented uh, pandemic, COVID, which once shut down the entire world, heralded a new era in the healthcare and expedited the implementation of technology in the healthcare services particularly. So healthcare is now shifting from the bigger clinical institute based to the individual home based care through the digitalized telemedicine and telecare services. So I am going to share a small PPT with all of the esteemed uh, speakers and the audience to share my views about this unprecedented pandemic and its effect on the healthcare and its effect on the application of technology in the healthcare sector.
Yeah, thank you, Dr. Garg. While your presentation is coming on, we will take 2 more minutes in as you are being a clinician yourself. Um, how do you see when a pandemic is being in, and you also have a very great connect with government, policymakers, etc. Do you think government support in this technology is also there, sir, for India?
The government immediately rolled down the rules and regulations for the telemedicine because there were double dilemma in the minds of clinicians. One was the mysterious nature of the COVID disease, and other was the medical legal status of the telemedicine, which was the only available mode of medical consultation with the medical fraternity. So government immediately came up with the rules and regulations, and government immediately chipped in just not only in the development of the vaccines, but also in the making the healthcare system more robust and making it more technology friendly to face the current pandemic and to make it enable to face the further pandemics in the near future.
Thank you, sir. Over to you, sir, with the presentation.
Ramdev, can you see the slideshow? So, my topic is post-COVID opportunity for the healthcare sector. So, as we all know, COVID has affected more than 11 crore people in the last almost 1 year, 11 months or 1 year. So, numbers are really huge, and all the parts of the globe are affected. Some are more, some are less. Here you can see the Americas are more affected as compared to the Asia. Europe and America are more affected. So total number of active cases right now is almost 22 million, and the closed cases is 87 million. So with around 24 lakh deaths. So in India, situation is comparatively better if we will compare with the situation in the North America and Europe. The mortality rate is quite less as compared to the Europe and America, and our response to the COVID as a nation, as a country, as an administrative unit, as a society is much better than many of the countries, developed countries. So, impact of the COVID is huge, and even more than the Second World War, which lasted almost for 6-7 years. So here is a slide where we can see almost every country, the unemployment is hugely increased. And here is a slide, you can see barely 3 or 4 countries are having positive GDP growth rate. Almost entire world is in the negative GDP growth, except very few countries. So in this grim situation, where world is under fear, economic crisis, medical crisis, social crisis, so there is a silver lining. The coronavirus crisis can be a catalyst for the entrepreneurship, particularly in the healthcare sector. Let's never let a serious crisis to go to waste. So there are two factors which will uh, promote the use of newer technologies in the healthcare sector. First factor is the technology push. Second factor is the consumer pull. So when the COVID struck and the lockdown was announced, most people at the most receiving end were the patients of the chronic disease. So under the fear of COVID, no institute was ready to run the OPD, and even no patient was ready to visit any medical facility from the fear of contracting COVID. So, consumer patient, they want uh, clinical consultation away from the hospitals. This was in the first time in the history of medical science that patient wants clinical consultation out of the hospital premises. And it was the technology, it was the availability of the 4G network as well as the smartphone technology which enabled the clinicians to start the telemedicine within a week or within a fortnight of this pandemic tragedy. So, it is quite clear now that COVID-19 will fuel the next wave of innovation. Digital healthcare entrepreneurs will help shape the world after the COVID-19 pandemic. So now, as pandemic is receding, so we are heading toward the beginning of the new era of telehealth and the high-tech healthcare. So, in this slide, I will discuss few mega trends in the healthcare and wellness. If digital health begins to mature, new business models will expand beyond physical medicine and care delivery to include behavioral health, digital wellness therapies, dentistry, nutrition, and prescription management. So, key predictions in the healthcare: artificial intelligence for healthcare IT application market is projected to reach 68.5% of compound annual growth rate from 2018 to 2022. And there will be approximately 4 million people with sight loss by 2050 caused by aging and underlying causes such as diabetes. There will be 39% increase in the number of people aged 65 to 84 by 32. So this is a glimpse of data, but there will be focus on evolution of human body, capabilities of the future, and the focus of the healthcare and wellness industry will be on the enhanced intelligence, enhanced sensing, extreme aging, disease-free body, optimized diet, sports optimization, digital biometrics, digital hardware enhancements, and enhanced strength and attractiveness. And COVID will also uh, force the big economies to shell out and spend more money on the healthcare sector. Here is a slide where we can see the projected growth of the budget, the health budget. So the dark blue line are of 2018 and light gray are of projected 2025. So here we can see almost every part of the globe will be spending more on the healthcare in the coming decade. So there is a few samples, few data from what is going to happen in the coming years. So in every 24 months, the frequency of data generation in healthcare is doubling. And there are 39.7 million health apps, and 75% of the patients are expected to use digital health services in the near future. 20 to 30 million internet connection of medical things or devices will be seen there by 2021.
Dr. Garg Saab, we have now crossed 10 minutes. Thanks, and your input is still, it is really valuable. Provided we have to give time and space for others, can we, continue and summarize, sir?
I'm just
Dr. Garg Saab.
Gigi. I'm just
Okay, sir.
the next technologies which are going to fill the gaps in the healthcare system and which are expected to make our healthcare system more robust as well as sustainable as well as capable to counter the future pandemic are data science, chatbots, blockchain, telemedicine, personalized digital mobile health apps. So, augmented reality, virtual reality, Internet of Medical Things, and artificial intelligence. AI products like IBM Watson and Sophia and driverless vehicle ambulances are already around us. So, we are expecting 5G will support 1,000-fold gain in the capacity of the Internet of Medical Things, and it will enable our system more tech savvy and to realize the dream of a home-based personalized telehealth care provision with the lesser cost and with the better results. So this is a brief overview of the projected healthcare system in the coming years. So this is my projection. This is my how I look down on the things in the coming years. So this is subjected to discussion, and it's my call to all. Let's start to realize the dream of a good telehealth system, healthcare system, which is more tech savvy, tech enabled to deliver a sustainable and affordable healthcare to all and every. Thank you.
While you have mentioned one specific point, doctors do not wanted patients to come to clinic during this COVID patient. So this is a big addressing point that technology can bridge a gap. And you have mentioned that various other statistics of what happened during this pandemic, how the GDP has impacted. You also have mentioned about what we should do and what we should focus in an IT sector. What are the technology that we need to do? It is a very informative information, Dr. Garg. Sorry for bargaining in between because of we have been given 1 hour time limit. That's where I have to. Thank you, Dr. Garg. And can I ask Dr. Shivali ji to come online and speak about what she understands as a doctor, what is her experience in the technology space, what technology that is demanded during pandemic, and also what is going to be the future.
So today I'll be speaking on how telemedicine is emerging as a sustainable solution after pandemic. So as we all know, the effects of COVID-19 has impacted greatly social, political, economic, and health aspects of the world. Healthcare industry is the one that is constantly evolving. And but despite of many devastating impacts of COVID-19, it does present the healthcare system with a powerful opportunity to renovate and reinvent itself. In fact, this pandemic, what I feel, it acted as transformation catalyst and caused healthcare system and organizations to adopt digital healthcare solutions, that is telehealth. So if we see what is telehealth, it is a healthcare where providers use information and communication technology in the delivery of clinical and non-clinical healthcare services. Now the traditional application of telehealth. This telehealth or remote care services were already in use emergency and in routine care previously. But during COVID-19, their wider utilization has accelerated on larger scale. That is, screening of the patients prior to their visit to specialists and monitoring of patients at home, which reduces the spread of virus to many population and medical staff on front line. If we see the COVID-19 application of telehealth. So during this global pandemic, telehealth is emerging as effective and sustainable solution. It allows to provide healthcare services to patients in all areas of the country in healthcare facility or patient's home. It basically bridges the gap between the patient and the doctor. Like in India is already a hugely populated country where already the patient-doctor ratio is very less. So in this scenario, the telehealth is working. Now we have three main roles. Number one, almost all the hospitals are adopting or trying to adopt telehealth to treat the quarantine patients. So first role is to screen patient remotely rather than having them to visit to any clinic or any hospital. This is the first role. The second role is to help provide routine care for the patients with chronic diseases who are at high risk. As we all know, that COVID can be very harmful and even fatal for people with compromised health. And by using video visits to doctor, it can reduce the patient's chances of getting infection. So the third role and main role is to prevent infection spread among health workers who are frontline heroic faces of the pandemic. So this also saves our use of gloves, masks, PPE kits and all. So that is also one of the roles. Now, if we see the post-COVID telemedicine, in this, the number one is rural telemedicine. This includes the setting of healthcare centers in rural areas so that patients sitting in any rural or remote area can be connected to for the consult to a doctor who is sitting in any metro city, Delhi, Bombay, anywhere in the world. It can be connected, which earlier nobody could have thought about. A definite time slot is booked. So patient, after consultation, patient feels satisfied that yes, full time is given to him or her, and he'll be able to discuss the problem, and finally he'll sit satisfied after the consultation. The second is virtual check-ins. The intent of virtual check-ins is to avoid unnecessary trips to clinic or hospital. Number three is e-visits. So this is basically communication with provider via online patient portals or via secured emails, where the privacy is the main concern. The virtual consultation is the last. There are inpatient or outpatients without face-to-face encounter. So as I come to conclusion, we have to communicate and describe telehealth modalities, benefits, and its use to public. We use and make efforts, to reaching to those patients who have limited technology and connectivity. Above all, we as healthcare professionals, we need to keep ourselves updated with latest technology. So with our Gladwin group of companies, we make it possible with our latest product line, which includes interactive flat panels, video conferencing solutions, PTZ Zoom cameras, all-in-one PC, etc. So we can connect easily all over the world. So COVID-19 serves as a reminder that proactive planning for healthcare and commitment to global public health preparedness is necessary. Thank you.
You summed up the teleconsultations and telemedicine, which is evolving science. So in a very well manner. So it is a take home uh, message from your side, the kind of telemedicine and going to evolve in the near future. So thank you. Now I will request Dr. Surya to share his views. Dr. Surya. Dr. Surya is also a clinician. So how he looks at the implementation of technology and how it is going to evolve and what is lying in the future, near future for healthcare. So I will invite Dr. Surya.
I'm Dr. Surya Prakash from Chennai. Yeah. Thank you, everyone, and especially Ms. Ram, to give this opportunity to talk to all the bigger people in the industry. And I want to talk regarding the doctors' adaptation to technology. And nowadays, the technology advancement is out of the day. And in medical field, we have seen it playing a significant role for the benefit of the patients and in diagnostic and therapeutic ways also. And basically, we are seeing the two technology assistants, like we have a clinical assistance and the diagnostic assistance, where we are using the technology for the doctors. So doctors are always passionate about the benefit of the patient and the treatment outcomes of the whole. Of course, the financial burden to make it off. The clinical assistants, we are in robotic surgeries, navigation technologies used in knee replacement and neuro and neurological procedures, which are giving very good results. And we are using it in interventional cardiology, where accurate measurements of stents and accurate placements, the latest version of the cath labs. And we are using in radiation oncology with the accurate site of the lesion, where we are able to give the radiation at the site of the lesion. And then EICUs, we are using it for the better healthcare delivery systems and even virtual clinics, like ma'am has already described it. And regarding clinical diagnosis, the latest laboratory equipment where we are using the autoanalyzers, and in radiology, we are using the 4-dimensional ultrasound, latest CT and MRIs with the like autoanalysis and high sample capacity with less turnaround time, helping getting results faster and accurately. And in ultrasounds, latest CT and MRIs aiding in diagnosis with superior quality imaging with precise use and protocols like pancreatic protocols or coronary protocols and all. And some we are using the viral markers, and even the genotype studies also there using the latest technology. Doctor willingness to accept the neurotechnology, more importantly, it should be economical, easily operable and benefiting to the patients. And this is only a starting step for the work from home for doctors with virtual clinics, which is beneficial to both sides, for the patients and the doctors. And digitization is a new beginning in the care. Thank you.
Technology in various specialists that you covered, surgeon and all that. Thank you so much for giving the insight, because you are the one white collared, normally COVID as in white collar as a god right now, correct? And not only now, it was our from past also and from future. When you adopt technology, that's when a technology, as a platform provider, can connect together. And thank you so much for explaining that doctors are ready, they are using it, and they are ready to use it further also.
Yes.
Thank you, sir.
Sir. I just apologize for the small technical thing in my place.
No problem.
So I could talk only through the phone and share through only the iPhone. Right. Thank you.
No problem. There are certain challenges. We all are working. That's called technology supports us. Thank you, sir. Right now, we would welcome Mr. Gaurav to talk about what marketing strategy that we should do. How do we bridge the gap? What the availability of technology, well, the consumer and also doctor, how they would aware of. Can we use what all media? Gaurav, over to you, sir.
Thank you, Mr. Ramdev, for the opportunity, and welcome all audiences and participants. Doctor before me have been the front runners in presenting a lot of technology solutions. Today, I am going to talk about something which is very close to you, which is about your organization and how using the technology which is already available now, how you can actually enhance your business growth. And there is a mix of technology as well as the marketing that will enable the adoption of technology from the doctor side as well as adoption of services on the consumer side. So with your permission, I'll introduce my topic, which is post-pandemic digital marketing jabs to grow your healthcare business. I am Gaurav Dhingra, and I represent digital agency Refresh Ideas and Refresh Healthcare. We help businesses to grow their revenue using digital strategy and marketing. As we all know, that pandemic enforced a huge shift in behavior for caregivers and patients. This tectonic shift has presented new landscapes to build institutions of the future, because there were already great institutions out from our country and across the globe. Now, to make a move for the new one, this is the right time and the backbone could be digital to deliver those solutions. The opportunity is ripe for healthcare professionals, especially, to use this shift and grow their reach beyond the four walls of their practice. So you no longer are basically bound by the geographical boundaries of your reach of your healthcare services. You could operate from anywhere, and complete solutions like telemedicine and virtual clinics can enable your practice and take it forward to geographies unknown to you at present. Let's also review a little bit upon how the consumer, the patients, are using the digital as of now. This is a research paper published by Google, and these are some key highlights from that. 30% of patients search for symptoms or departments, example, sore throat, pediatrics, etc., when they are on the search. 37% patients search for conditions or diseases like arthritis, cancer, and things like that. 19% patients search for branded solution. For example, they have a soft sport, or they already know a big brand and they will use that brand to reach that particular facility of their choice. But that's only 19%. That leaves everything else above it open. And 6% patients search for specific treatments and procedures to enhance their knowledge. So this is a little bit of a inside story that you should all be aware about. But what is currently happening? Whenever you do these kind of searches as a user, and let me speak as a user first, as a patient first, we end up landing on pages like Wikipedia or international website, mostly from US or UK, sites like Mayo Clinic and things like that. Most of the information presented is English only. 58% of Indian hospital websites that we researched in 2018-19 are actually defunct. For example, they are not even properly opening. The information is stale. So this is the state of when we are serving that kind of a curiosity of users, how they are landing on us. So what's the result? Only a handful of institutions get the benefit of this massive user base, which is being generated not only from India, but also across the world, trying to come to India for medical services. And a large chunk of population is not served, and that creates a vacuum. Now, let's talk about how to digitally grow your healthcare business. We are talking about professionals who want to adapt, professionals who want to build institutions for the future, who wants to use digital as a backbone of their service. The number one thing is to start with a long-term vision, which is patient-centric. It cannot be about your organization or your innovation. Patients or users across the world do not give any importance to that. If I have a problem, I will only be concerned about that problem and the easiest path you can bring me for solving that. So when we talk to various organizations, especially in healthcare, we come back and tell them this is not about you. This is going to be about the patient, how you are making their journey smoother. They can understand your language, not your medical language, but actually the language that they stop. As a second step, find a right team with expertise in business strategy and digital technology. It's not only technology that serves, it has to be tied in with the strategy of how you are building it for next 3-5 years. It is not next month or a month after that. Once you understand that, go and find the team. Bring the team internally or externally, but they should sync with your vision perfectly. Redesign a digital experience. Optimize your website for serving digital first patients and providers so that your doctors feel comfortable using the technology first of all, and also when the patient comes in, they can see information, they can consume that information, they can interact, and they can actually avail that kind of information properly, book those appointments. So keep the digital first patient experience top in mind when you are redesigning a digital experience. Start on a journey for content creation. Use English and other local languages wherever your target audience is. You know you have to define your target audience, and once you have defined that, use local languages so that the people who may not be influenced by English, they can be influenced and can capture the data in their local language. Optimize your pages, your website, your presence with conversion in mind, search engines, and make it mobile friendly. And one of the experiments that we recently did, we checked top websites of the hospitals, and we found that they want to use a lot of blurbs, a pop-up coming over here, a chatbot coming on top of that. When you use these services on a mobile, which is like 70% and above people are using these services from mobile, this create a hindrance for getting the right kind of a knowledge, and they move away from your website and they go back to the old ways of doing dealing with the healthcare practice. And once you have taken care of these major steps, then get onto the social media to increase your awareness, to tell the world how you are helping them, how you are bringing new technology. Talk about the new things like telemedicine. Tell them that you save, how you save coming on a telemedicine bandwagon. Start the virtual clinics, start whatever you want to do. Because if you talk about few months back, prior to COVID, the complete solution was not available. But with the innovations like Tata Communication GlowHeal solution, which can bring you all the solution away for the consumer for easily grasp at a fraction of a cost, and then you can fulfill the whole promise on a digital roadmap for that customer. Not only that, you can have initiate interactions with the customer physically, but later on for a remote patient access, for the OPDs, you can call the patients later on. That will bring and enhance your market substantially. So build a digitally powered business, not only a presence, a business that is powered digitally, because then you have the opportunity to scale up to whatever limits. Thank you, guys. That's from my end. Hope this is helpful.
Thank you, Gaurav. I was about to buzz you. Thanks for completing within this time period. And I would like to, it's been our honor, Tata Communication, been honored to have such a great speaker who are not just in a digital market, who also an healthcare experience. Now, I would request, is there any, I would request from Ria, is that do we have any questions from the participants? Before that, I have 5 minutes. I needed that because there are certain questions I need to ask the speakers. Is it okay with you?
Yes, absolutely. But to just answer your question, yes, we do have a lot of questions from the audience.
Oh my goodness. Okay, so how do we do? Because it's a lot. So, okay, I'll have short questions to everyone. I believe everyone would answer it in short also. Dr. Shivali, ma'am, you are a dental, vice dental surgeon for profession. What do you think as if like the challenges faced during the COVID, ma'am?
Sir, post-COVID, actually, there were many challenges initially. So as a dental professional, we are already at very high risk for infection, because this virus, as we all know, is in the nasopharyngeal and salivary secretions, and it spreads through respiratory droplets. So we were in very close proximity to the patient, and there is a lot of aerosol generated. So we really have to take care. Otherwise, we are at very high risk. So we had taken double precautions. We were already using gloves, masks, and then eye wears before this pandemic also. But now we have to be double careful, right from the fixing the appointment of the patient till maintaining social distancing in the waiting room, proper history taking of the patient, any travel history, proper sanitization of the patient, proper cleaning and sanitization and hygiene maintenance in the clinic, just double the efforts, and the procedures we limit. First we tried, plus tele-dentistry we have applied. First, whenever patient wants appointment, we try to do it virtually. If at all required, then only we used to call. That was in the initial phases, but then we have managed with the with the help of our technological devices, teledentistry, as I told you. So earlier we had to promote that extraoral imaging in place of intraoral imaging. Then we had to restrict the use of our ultrasonic instruments, which what all generates aerosol. So then we had to educate and update ourselves and our staff also how to use the latest technology. And we have to explain it to patient also, that you also have to wear gloves and give detailed history and wear this apron and that shoe covers and everything. We have to educate and convince patient also. So these are the challenges, but it's okay, we have managed with time. And
so if I have to summarize what you told, ma'am, you have saying that you had faced challenges when a security point of view for doctor, life's threat. But what you did is your duty. So hand salute from Datacom, and rather from humanity, we salute all of our white collar doctors, nurses, and healthcare service provider who took risk. But what you said is, in a shorter duration, you adopted the technology because there was a demand for it.
Yes, yes.
Thank you so much, ma'am. And Dr. Garg, we would like to know from you, was there any use cases that was being adopted from a technology point of view during COVID, sir? You can talk about any of the experience that for personally you have did it, or you heard from someone else that technology helped during this COVID, sir.
Ji, thank you, Ramdevji, for providing such a nice platform to share my views. Here in PGI, immediately after the announcement of lockdown, we started two telemedicine centers, one at Satellite Center Una and one at Satellite Center Simrur, with the POCT facilities for the chronic patients of PGI, especially from the neurology, hepatology, cardiology, endocrinology, OBS, and rheumatology. So our experience was very good, that in terms of the patient compliance and in terms of the carbon rating and in terms of the affordability. So it was even a better experience than the physical OPD. The only need we felt that is the requirement of the development of the dedicated hardware to plug the loss of information during the normal telecom. So we are trying to bridge that gap with the involvement of industry, and I am happy to share with everybody that with Tata Telecommunication, we are planning 10 virtual super specialty clinics in collaboration with PGI, just for improving the compliance of the chronic diseases patients in the remote areas. So our experience is wonderful, Ramdevji, and the patient compliance, patient affordability, and the hospital administrative feedback is very good. There is less crowding, and the only thing we feel that which requires improvement is to plug the gaps for the loss of the information in terms of the history as well as the physical checkup. So that's the only need of the hour. Thank you.
Thank you, Dr. Garg. So what you are saying is that's why platform like Glowheel, Tata Communication, or any other industry for the matter, we are there to help bridge the gap to doing experienced clinician who help to maintain health care people and then also because our economy is dependent on the health of our public. Thank you so much, sir. We would be enhancing our product and we would be helping you all the healthcare experience to maintain, right? Because our economy is would be helping all the healthcare. 5-10 minutes not possible. We should give it to you. Hand over to you.
Sir, I guess we are already at 3:53. We should be addressing the questions, but yes, whatever suits you, sir.
Please, ma'am, over to you. I thought I can take more 10 minutes, but I'll leave it to you, ma'am. Over to you, ma'am. Please take care. Please
Thank
go ahead.
you so much, sir. I guess the very first question is for you here, and the question says how TCL and Tata Medical Diagnostics can bridge the gap for patients in the remote areas.
Wonderful, ma'am. To answer that question, Tata Communication as a strategy, Tata Communication business covers as a technical platform. Tatacom just not provide a software. We provide a complete ecosystem. Tata Communication Limited under a Glowheel brand has scaled up a solution which is not just a software. It has an end-to-end solution of network, IT hardware, telemetric devices. What that enables, that makes sure the comfort for a patient, so they do not want to travel long distance. A doctor gets all the information at their hand, by which they do not waste their time in doing a lot of analysis, because our platform also enable with AI. So this platform can bridge the gap. A first customer, as Dr. Shivali has said, that the first consult can be a general consult. You can analyze, you can see what has to be done. Then predominantly test can be done through our telemetric devices. Further to which a physical, by which you do not crowd this place. You give a space for avoid communicable diseases. Number two, you can have a doctor can save more time, they can attend more patients, etc., etc.
Sure. Thank you so much, sir, for that. The next question we have is Dr. Garg. Dr. Virendra Garg, if you're hearing me, please help me with the answer here. The question says, how do you perceive the role of health informatics technology is going to be here in India? The attendee is asking you if the healthcare professionals in India should start training in these sectors.
So see, here in India, the healthcare information technology had a greater role than the developed countries, because now wearable devices are available at a cheaper rate. So as Dr. Shivali discussed, that we had lesser doctors, qualified doctors. So in bridging that gap and for the good research, for the bottlenecks in our healthcare system. So healthcare information technology has three applications. In our case, one is to make the healthcare available at affordable price to the peripheral people, and second, to increase the compliance of the poor people. Third, to collect the data for the robust planning for the problems.
Sure, sir. Thank you for that. Dear panelists, I'm keeping my questions open to you. Please feel free to pitch in your opinion and answers to this. The next question says, how effective is testing a patient virtually and recommending the medicine? Is it possible to diagnose correctly and give treatment? I am sure we are giving it, but if you can have your views on this.
Yeah, Dr. Surya said, I would recommend you to answer this, because you are saying that you are connecting with Tatacom. You're planning to open up a 25 to 100 center virtually because you see a success there.
Hello.
Yes, sir. We can hear you.
Yeah. Hello.
Yes, Dr.
Yes,
Surya,
Dr. Sir, we can hear you. You can go ahead, sir, without a video also. That's okay.
Okay. Can you come back to me with the question, please?
Sure, doctor. The question says, how effective is testing a patient virtually and recommending him the medicine?
No. Actually, because of latest technologies, like what Tata Glowheel is supplying all the electronic stethoscope, otoscope, and all, and with a trained personnel sitting in the virtual clinic, where we can train in every system of examination. The clinician can only give the instructions of what to do with the patients, and he can observe with the high focus cameras, so that the clinician can get all the clinical inputs from the, almost not exactly like a physical clinic, around 80-90% he can be taking a clinical diagnosis with the help of the technology and the person sitting there. Yeah.
Sure, sir. Thank you for that. The next question here says, how do we connect with the customers who are not that digitally savvy to help them with telehealth and telemedicine services?
Same to me, or?
Probably I would ask Shwali ma'am to respond this if she's hearing the question, or.
Yes. See, this telehealth is very useful, but there are certain limitations, and it is one of them, that there is very limited access to technological devices, especially in the rural areas. There is a problem in internet connectivity, and the main thing is poor health literacy among the general population. Like, they are not aware. So that is the area where we have to work. We have to make them aware. And there are other issues also, like they have some privacy limitations, their level of comfort, like using it, and this cultural acceptance somewhere. But here we have to work on it. We have to, make them aware. We have to go and provide. And, we can set up virtual clinics and centers over there. And then, we can speak about it. And that's how we can spread the, knowledge about it.
Sure. Thank you so much, Doctor, for that.
Thank you,
Next
Dr.
question.
Yes.
So, Mr. Krishnan, the next question here says, how can digital platforms be used as clinical trials and for health research?
Yes, this is really a question which may not be, this is not that we are new to digital. Digital has spread across in all the vertical, till automobile, which is the first vertical that digital has evolved. Then you can talk about education and various now healthcare being there. And when you say analysis, this would help, like you have artificial intelligence, data mining, all this various technology which is available. But how do we do? That is all in the hand of doctors. We cannot directly, use any international data like what Gauravji has said. We need to have our Indian data. That is why a project which can help to digitalize, like which National Health Authority is planning for, to create a national digital health mission platform through which each and every patient record, irrespective of his transaction from a general physician visit till his surgery, what is his problems that he's gone through? Can this information available on his pocket? That mission, that digitalization, surely going to know what a patient has gone through, what is his wellness, what he has to do, because healthcare means that his life expectancy has to increase. He has to live with less diseases, plus he should have an information for it. So one platform that I don't want to again brand Tatacom's product, but there are other companies who's doing it, but we are pioneer in it. We are having a framework which can support, ensure that the healthcare provider can use a platform, gather information that can be given to the user as a consumer, can predict, analyze through our AI and data mining method.
Sure, sir. Thank you for that. Seeing the clock ticking by, we're taking last few questions here. And the question says, employees are facing a lot of mental and physical stress while continuing to work from home. So what kind of technological activities can reduce such stress while continuing the office work from home?
Dr. Garg, if you can explain us, because you are best in the human psychology and you are doctor yourself.
Can you please repeat the question?
Sure, Dr. Garg. The question says employees are facing a lot of mental and physical stress while continuing to work from home. So what kind of technological activities can help here to reduce the stress?
See, one is the audiovisual, because in the normal conditions, I don't recommend the working from home, especially from the closed pervasive closed rooms. So audiovisual connectivity during the lockdown and during such problem can help us in communicating in a better way rather than the only audio. And second is the continuous counseling as well as indulgence and the light physical exercise, meditation, yoga. Such measures can keep us away from depression and from the other mental problems. So these problems are there due to the lockdown and unplanned lockdown. So now we are evolving, but it is a challenge yet for the medical science because we had lesser number of psychiatrists and people are shying away from visiting the psychiatrist, psychological counselors or psychiatrists. So involving oneself into the audiovisual activities as well as audiovisual connectivity with the other people around you and the yoga, meditation and light physical exercise. So these are the ways where we can keep healthy.
Thank you, Dr. Gar. Adding to it, last, I would for that from an point of view, if can ensure that the wellness program and diagnosis, what you call that as consultation with psychiatrists, therapies, and wellness program through online digital media is available, but a structured wellness program.
Dr. Krishnan, I cannot hear you.
An employer, if an employer can focus on well-being, one, as Dr. Garg said, audio and video, visual, physical, yoga, yes, good, that is one, but a structured way of probably enabling a virtual consult in their organization, providing a wellness. There are right now a lot of programs being done by the employers and taking care of their health, but this has to scale up in a right structured way. There are many wellness partners are available in the market, ma'am. Probably they can provide such solutions.
Sure, sir. Thank you so much. One last question, just on an update. Is there any update on the Government of India policy regarding home healthcare for senior and chronic care patients?
Dr. Garg Saab, do you have any insight on this?
Sure. The question says, is there any update on the policy side of healthcare for senior and chronic patients at home, for treating them at home?
The telemedicine and healthcare directions are same for all the patients, but curative medicine is now evolving, and so there is recognition to the postgraduate and postdoctorate courses in the geriatric medicine, but policy is the same, and telemedicine guidelines for all the patients are the same.
Sure, sir. Thank you so much. Thank you all panelists for being with us here today. I'm equally grateful for all our attendees for being with us. Dear attendees, we have tried to answer all the questions here, but in the interest of time, we are leaving on few. Please do reach out to us through any of our online and digital communication channels. We will always be happy to help. Until next time, please take care and stay safe.